Hi, and welcome to another edition of Your Health with Dr. Christy. My name is Dr. Christy Reisinger, and today I'm going to give everyone an update on monkeypox. Monkeypox continues to be in the news and has been declared a public health emergency in the United States. The total number of confirmed monkeypox cases in the United States is over 6,600 at this point. In Austin, where I live, there are currently 9 confirmed cases, 46 probable cases, with about 300 people being monitored or waiting to hear back about results from their testing. What do we know so far about who is getting monkeypox? A great article in the New England Journal of Medicine that was published at the end of July collected data from across 16 countries from the end of April until the end of June 2022. During this time, they discovered 528 cases and found that 98% of the cases were in gay or bisexual men. 75% were white, 41% were infected with HIV, and the median age was 38 years. Transmission was suspected to have occurred through sexual activity in 95% of the cases, and a third of these patients admitted having attended a high-risk sex on-site event within the last month. Upon presenting to the doctor, 95% of patients had a rash, with 73% of the rashes located in the anogenital region. But the skin lesions varied widely in how they looked, and most patients had fewer than 10 lesions seen. Here's a collection of pictures in the article that gives y'all a good sense for how varied in location and appearance the rash and lesions can be. And besides this rash, in 63% of cases, people also had fevers, and in over half of the cases, patients had swollen lymph nodes as well. After exposure to monkeypox, patients developed symptoms in about 7 days. Hospitalization was not needed often, but when it occurred, it was mainly for pain control for severe pain around the anus or rectum, or an infection of the skin that developed after the rash. No deaths were reported. So to summarize this article, monkeypox appears to be targeting men having sex with men, possibly those participating in high-risk sexual activities without protection, and with multiple partners. Although I do want to make clear that monkeypox will not be limited to a specific gender or sexual orientation. Viruses never limit themselves this way. I would say the best way to limit spread of this illness at this time is to limit high-risk sexual activity. This includes casual sexual activity with partners that you do not know, sexual activity without a condom, or sexual activity under the influence of drugs or alcohol when you're unable to make a clear and rational decision that can protect yourself. We do also know of people that have contracted monkeypox without engaging in sexual activity. But contraction of this virus still involves prolonged skin-to-skin contact or through large respiratory droplets like saliva. This isn't an easily transmissible disease. You can't contract it through casual contact, like shaking hands or touching an elevator button after someone else has touched it. It requires prolonged face-to-face or skin-to-skin contact with someone that's infected. In order to get tested for monkeypox, a person will need to have a rash. The rash is how a culture is taken and then sent to a lab for testing. Testing was once fairly difficult to obtain and had to be done through the health department, but now large private labs like LabCorp and Quest are offering monkeypox testing. There is a monkeypox vaccine that's manufactured in Denmark. The United States has a very limited supply of the vaccine and is currently giving the vaccine only to those people after a high-risk exposure to someone with a known infection with monkeypox, or if someone has had multiple sex partners in the last 2 weeks in an area with known monkeypox. In Austin, we currently have 3,000 doses of the monkeypox vaccine known as Jynneos, but that will serve 1,500 patients since 2 doses 14 days apart are needed. The U.S. government is working with the manufacturer of Jynneos in Denmark and are hopeful that more doses of the vaccine will be available in September. There are no FDA-approved medications to treat monkeypox, and thankfully antivirals are usually not needed anyway. Most patients recover on their own without ever needing hospitalization within 2 to 4 weeks. People with monkeypox are being asked to isolate during this time until the skin rash has completely healed and the skin has returned to normal. To learn more about monkeypox where you live, go to the public health website for the city you live in for that data. And in conclusion, please severely limit engagement in high-risk casual sex with unknown partners, and especially sex without a condom, to prevent the transmission of monkeypox as well as other infections such as HIV. Thanks for joining me.